Hi, I'm Maggie Laukent with Maryville University, nurse practitioner student, and this is my patient, my volunteer patient, Dave, and he is going to be allowing me to do an abdominal assessment on him. So the first thing that I had Dave do was empty his bladder before we started, and I'm going to just do inspection. I'm looking for any nodules, lesions, scars, making sure that I see symmetry in his abdomen. I'm looking for contour. Dave has a rounded abdomen, which is normal, and I'm looking for any distension, masses, hernias, muscle separation, that sort of thing. The final thing that I would do just to check for anything extra is I would just shine a light across his abdomen, noting to see if I could see anything further than that, and that essentially is negative. There would be 3 types of movement that I would see. I'm noticing that he's breathing smoothly, and that's his respiratory movement. There's also surface motion. I might notice any peristalsis that happens. And then the aortic pulsation, which is not visible in Dave. That's the aortic pulsation is reserved for much thinner people. The next thing that I'm going to do is auscultate. I will start in his right lower quadrant, and I will move up to his right upper, his left upper, and then finally his left lower quadrant. I will listen to each quadrant for about 1 minute for sure. If I felt like any sounds were not active at all, I would say that I would have to listen for a full 5 minutes. But I should hear between 5 and 35 clicks, gurgles, squeaks, different noises of his intestines working. Dave's bowel sounds are normal active. I'm also going to listen now on his liver and spleen, and I will be listening for any friction rubs. Again, I'll be using the diaphragm of my stethoscope. And I don't hear any friction rubs. Next, I'm going to turn and I'm going to use the bell of my stethoscope, and I'm going to be listening to his abdominal arteries, the aortic, the renal, the iliac, and the femoral arteries. And I'm just listening for any bruits. And then I will also listen in his epigastric region and his umbilicus area for any venous hums. The aortic artery, the renal arteries, the iliac, and the femoral. The femoral and the iliac on the other side. And then around the umbilicus area for any venous hum, and up in his epigastric area for any venous hum as well. Next, I'm going to percuss. I'm listening for 2 different sounds. I'm listening for tympany and for dullness. Tympany is typically going to be heard in the intestines and the stomach area. And dullness is typically in the liver area and the splenic area. And then I'm going to actually measure his liver span. So I'm going to start in his midclavicular area and start high, probably right around his 5th intercostal space. And I'm just going to begin to percuss until I hear the dullness. And then I am going to mark that area. And then I'm going to go from the low tympanic area until I hear that dullness again. And I'm going to mark that area. And then I'm going to measure the area. And it should be between 6 and 12 centimeters, and Dave is right about the 6.5 mark. And so that is normal for the liver span, the size of his liver. The next thing that I'm going to do is also check the descent of the liver. And so Dave, I'm going to have you take a nice deep breath. And I'm going to start low again until I hear that dullness. And I'm going to measure right up to that other mark for the lower part of his liver. And it's about just a little over 3 centimeters. And we would typically see this descent as about 2 to 3 centimeters. So that is completely normal. The next thing that I'm going to do is I'm going to percuss his spleen. I'm going to go right down the mid-axillary line on his left-hand side. And I'm going to start way up there about the 6th rib, the 6th intercostal space. And when I hear that dullness, it's typically around the 9th, 10th, 11th intercostal space, and that's his spleen. I'm going to have you roll just a little bit to your side, and I'm just going to give him just a moment there, and then I'm going to percuss for any gastric air bubbles. Good, thank you. The last thing I'm going to do is palpation, and we do both light and deep palpation. The light palpation kind of gets Dave's abdomen used to my hands if they're cold or anything like that. Of course, you'd want to warm them up, but it will help him just kind of get used to me touching him. And I'm just looking for smooth and soft. And so just light palpation is about 2 to 3 centimeters. And all the while I'm looking at his face, noting any wincing or guarding. I didn't have any of that, so I'm going to go ahead and do some deep palpation. Again, we're looking for any masses, any resistance, any tenderness. If we did find a mass, we would note the size, the shape, the consistency, and any pulsation with it, or if it's mobile at all. So I'm going to do some deep palpation. And again, I'm looking at his face, and he's very calm throughout the assessment, noting no tenderness or pain. I'm going to go around his umbilical ring and the peri-umbilical area, noting if it's round and regular around the umbilicus there, and just making sure there's no nodules or bulging or granulation. And again, the assessment is negative. The last thing that I'm going to be palpating for are his organs. So I'm going to palpate Dave's liver by having him take a deep breath in. And I'm just going to go under that rib cage to see if I can. There, we've got her. And I can feel the liver. So that's good. It's firm, it's smooth, and again, non-tender. The next thing I'm going to palpate for is just below that liver, and that's the gallbladder. And it's not palpable, which is a normal finding. Next, I'm going to go to the spleen over here on his left side, and I'm going to go up in there, and I cannot palpate his spleen, but that's a normal finding. I'm going to palpate both his left and his right kidney, so I'm going to put one hand underneath him, and I'm just going to palpate to see if I can feel his kidney. And on his right side, the same thing. The last thing I'm going to be palpating for is just to the left of his umbilicus. I'm going to see if I can find that aortic, the aorta artery, and I can't necessarily find it, but it's just to the left, and it's about 2 to 4 centimeters. The final thing would be to palpate for his bladder. Dave did empty his bladder just before the assessment, so I probably won't be able to palpate his bladder, but that would be done just above his pubic bone, and by pressing in, you can find the top border of the bladder. If I suspected ascites on Dave, there's one last assessment that I would do, and it would be percussing for the dullness of that and looking for a fluid wave. So Dave, I'm just going to have you take your hand kind of at an odd angle here and press there.
Yeah.
And I'm gonna push on his right side of his abdomen, and I'm gonna feel on his left side just to see if there's any fluid wave. I didn't see anything and I didn't feel anything. Thank you. So that completes the abdominal assessment. Thank you for watching, and thank you for being my patient.